Ladies and gentlemen, welcome to Hemodialysis in simple terms. Today, I will be speaking about hemodialysis and how it works like the human body. Hemodialysis is the most commonly used method for treating kidney failure. Before hemodialysis can be performed, a patient needs to have an access. For an emergency cases, a catheter in subclavian or in the jugular or femoral catheters are placed. But for patients who are already diagnosed ahead of time, they can have a fistula or a graft. A fistula is a more permanent access created surgically and is usually located in the forearm by joining or anastomosing an artery and a vein, preferably on a non-dominant arm. Needles are inserted into the vessels to obtain blood flow adequate to pass through the dialysers. Arteriovenous graft is created when a fistula is not a viable option for a patient such as those with compromised vascular system. Two needles are inserted, one for the arterial line and one for the venous line. The arterial line is going outside to the body and going to the dialysers, and the venous line is the one that's going back to the patient. Now let's track the path of the blood that's coming out of the patient, going to the dialyzer. The red line goes to the arterial chamber, which secures any bubbles so that it won't be introduced into the dialyzer. After the arterial chamber, the blood goes to the pump. They call it the blood pump. The blood pump acts like your heart. It pumps blood to the kidney system. For this matter, the blood pump pumps blood to the dialyzer. This is the dialyzer. The blood from the pump enters from the red part of the dialyzer from the top going downward into the venous chamber. This collects air, whatever's left in the dialyzer. If there is air, the air detector will alarm and the clamp will clamp so that the air won't go to the patient. This is now the venous circulation. This is the clean blood that's going back to the patient. As you can see, the blue line. The dialyzer has a countercurrent flow, meaning that on the blood compartment, the blood flows from the top going to the bottom. And on the dialysate side, the dialysate flows from the bottom going to the top, creating a counterflow. So, in other words, the blue on the dialyzer, the blue is going in, that's going in, going up, and this is the red, that's where it comes out. When it comes out, it goes back into inside the machine and it will be filtered out outside and the drain in the back of the machine. But let's say that the machine has a ureter too. I will show you where it is. This is the ureter. That's where all the toxins and the waste product collected, and that's where it gets funneled before it gets excreted out in the back of the machine. That's where the drain is, right there. And that should be the urethra. Not the white one, that's the water supply, and the red one is the bicarbonate, and the red one is the acetate. The two combines and make your buffer system. The black one with the dripping water, that is your urine. That is the drain from the dialyzer. That is the waste product being eliminated. To control the fluid being removed, you have to set the parameters. And these screen windows, you have some buttons over there, and you have the goals, the time, the diastole flow, the temperature of the machine, and the conductivity of the machine. The conductivity of the machine, it should be between 13.5 to 14. The temperature should be at 37 degrees Celsius. Normally, or typically, the blood flow should be at least 350 to 400 ml per minute. This machine uses the cc for the UF goal. So if you're trying to remove 4 kilos, all you gotta do is punch in 4000 cc to remove 4 kilos. And hopefully the machine does its work, then it would remove 4 kilos. Now the toxins are also removed from the blood in the dialyzer to the process of diffusion. The water is removed to the process of ultrafiltration. And ladies and gentlemen, that is hemodialysis in simple terms. So we have the dialyzer, acts like the kidney. The blood lines act like your blood vessels in your body. The blood pump acts like the heart that pumps blood to the kidney to remove all the waste product, and the ureter that funnels the waste product towards the urethra, which is the hose in the back towards the drainage. And I would like to thank my good friend Mr. Amilu Layugan RN for his cooperation. Ladies and gentlemen, thank you for your attention, and I hope you learned something today. Goodbye.